guys. What's up? We are back with another video. It is I, Samantha.
I'm Lizette.
And today we're going to be giving some advice to new graduate nurses. We just want to give you guys a little bit of tips because I know sometimes it seems a little hard when we start working in a new job and we don't know where things are. We don't know who people are. We don't know how to, pretty much function in that area because this is a new job for us. So just wanted to give you a little bit of background tips.
Right. So a message to the new grads. You want to go with your first tip?
Okay, so my first tip to you guys is it's more so of a personal thing. It's okay for you to feel like you're dumb. I know it sounds dumb to say and like kind of weird. Like, I'm not dumb. We're not dumb. When I say that, and when I say that, I don't mean like you're dumb physically, but I mean that when you're just there, you're not competent yet in that specialty. So we've transitioned from two different areas. Like, I used to work home care. I used to work ambulatory surgery. I used to work child psych. And then I went into ED. Like, it's totally different when you're in a new area. So it's okay for you to feel dumb. All you have to do is just shut up, humble yourself, take everything that you can in, and do what you have to do. That's it.
Right. A tip I would give is don't be so quick to join in on the gossip. Like, I know when there's a good gossiping session by the nurses station, you just want to jump in, you want to add your 2 cents, but you're the new kid on the block. Yep. And people could talk bad about each other, but the moment someone else says something bad, now you become the enemy. Don't get involved with it.
Exactly.
It's entertaining, but when you're new, don't do it. Just listen. Snicker to yourself. Don't add any input. Don't get involved.
So just to piggyback off of what Lizette said, I will get into the topic of friendships. So I would say that you have to be on your guard when you are working in a new job. Not everyone is going to be your friend, and you have to accept that. You were born alone, but friendships will come.
It's true.
Yeah, like, just take it lightly. Like, don't expect that your friends are always going to be with you on things. And honestly, sometimes there comes the case where your friend will be in charge and they can't give you certain things that you would like. You just have to accept things the way that they are, because there are some people who come in and they feel like because they're your friend, you have to give them a certain assignment, or you have to give them, like a leeway when you're working, like it's their time to just chill. Meanwhile, it's not, so just be on your guard.
Yeah, you can definitely make friends, but don't expect favoritism because of the place that you form, because that's when it gets a bit sticky. Next bit of advice is not everyone is a bully. Like, constructive criticism is still a thing. I've seen it happen so many times, like especially when I started new somewhere and I'm with another group of new nurses. They would say, "Oh my God, she told me that I'm not supposed to hang it that way." And I'm like, but you weren't though. Like, it's not everyone is trying to be a bully. People are trying to make sure that when you are on your own, that you do no harm to your patients. And this is the time for them to be able to criticize you and tell you how to do things better, because when you're on your own, your preceptor also has their own district, their own assignment. They're not going to hold your hand throughout your shift. So sometimes take it easy. Don't take things personally, and realize that sometimes people are just trying to help you out.
Yeah. So to piggyback off of what Lizette just said, please do not cut corners. Do not cut corners. You are on orientation. Whatever you see Jill and Jack and Bill doing over there is their business. It is not your business. Yeah. You practice how you are supposed to practice, how you were taught in school. Use your critical thinking, use your judgment before you implement something. That's exactly what I need to say, because a lot of you guys get off of orientation, and not even get off. You are on orientation. You feel like you want to follow your preceptors with their bad habits. No, that is not the way to go. You will lose your job.
Yeah.
You are literally on probation for a certain amount of time. You have to think about your job in that same aspect. Do not do it.
Great. The same with the well-known nurse dose. I know you've seen the meme. You like them on Instagram because it's funny, but the ink on your contract isn't even dry yet. Like, don't play yourself. Don't get got. I don't care what you see other people do. You are very new into this area. Don't play games. Follow the doctor's orders. Now, if you feel like what was ordered for the patient is not enough, then advocate for your patient. Speak to the doctor. Hey, I don't think this dosage of X medication will treat their pain. Do you think we can either give something else or give a higher dose?
Right.
That way, your license is safe. You advocated for your patient. Everyone's happy.
Agreed. I really agree. Yep.
All right. Yeah. Your go.
So my next advice would be to keep an open mind. Don't be so quick to give up because you feel like the work is hard. Like, you know, it is going to be tough. You're going to have your days when you feel like, yes, I'm Superwoman, I'm Superman, I can do this and I'm going to do it. And then you're going to have your days where it's just like, I hate my preceptor. Like, why am I here? You just have to be patient. Yo, when I started working in the emergency room where I am right now, me and my preceptor, we were like it was a punching match. But now we okay, we good.
Now.
Suck it up. I had to suck it up and just be like, you know what, Samantha, hothead Samantha, relax. This is a job. She's nice enough to teach you this. Take it in and just kind of work with it. Work with what you have and, you know, do what you got to do in order to get off orientation. And then when it's time for you to practice on your own, then you can do whatever the hell you want. You don't have to hear people bickering in your ear. You don't have to hear any of that, you know?
Something that I just thought of too was be confident, but don't be cocky. Because the things I've seen, and I'm just like, so here's the thing. You're never going to know everything. You especially don't know everything right now. But guess what? The most senior nurses don't know everything. Even though they may act like or seem like they do, they don't. So with that in mind, when someone is telling you something, don't brush it off. Because you think you know what's best. If someone's telling you you need to put on PPE, put on your PPE. I don't care if you were sick already, right? If someone is telling you about your patient, like, hey, I'm noticing XYZ, don't take offense to it. Don't say, oh no, she or he doesn't know what you're talking about. And now your patient's dead because you didn't want to listen. Like, relax. Have confidence in what you know, but also confidence is also acknowledging the things that you don't know so that you're willing to take in new information from anyone. I learned from people who's been here for years, and I learned from people who's been here for a week. There's something to learn from everyone.
Of course. You're going to come across people who have nasty attitudes.
Yes.
It's just common. People, especially when you're a young nurse, you're still in your 20s like us, and you come into a job and people are looking at you like, oh, so you're here to come and take my job away from me? I'm not going to teach you nothing. Honestly,
I experienced more of that in clinicals.
Right. No, but even at work too, not at our current job, but even at work, there are some people who come across.
Because I was like, our job, we don't have that. Yeah, our job is pretty damn good.
Because honestly, because you have not only nurses, but sometimes you have your aides, sometimes you have your technicians, like your CT techs or ultrasound techs or whatever, and they're looking at you like, oh, this is a young nurse, like, you know, and they're kind of like hating on you in a sense because they know you're young and you're getting it. So, you know, I think these people just need some time to get to know you, because eventually once they get to know you, they become like your BFF and you guys are cool.
That's true.
But just don't take it personally. Just look at it as, you know what, maybe he's having a bad day. Maybe she's having a bad day. Maybe tomorrow will be another day. The only thing I will say is don't kiss up. Don't kiss up to nobody. Don't suck up to nobody. There's no time for that. Continue being yourself. If somebody gives you attitude, don't even get mad. Just be like, okay, God is alive, and then just keep walking this way. Just walk away. Walk away. Don't even say nothing no more. Like, you're gonna find attitude everywhere you go, even amongst your own peers.
Yeah.
Just don't take it personally.
Don't learn how your unit communicates in a way, because when I first came into the emergency department, I thought people were so like short with each other, like so harsh. And I'm like, oh my God, everyone here has an attitude. But then I'm realizing that it's an emergency department and this is a critical situation. If they say, pass me the bolus, they're not going to say, Samantha, may you please pass me the bolus? It's like, no, pass me the bolus now, or give me the epi now. And then afterwards, we'll laugh. So again, it is it was a culture shock for me, because before that, I worked in mother baby. I did pediatric home care and a little short stint at a doctor's office. So complete culture change when I started working in the ED. And now I find myself speaking like that too when there's an emergency.
And I mean, sometimes it's, you don't really realize you're doing it, but when you're in a code situation and you're trying to save somebody's life, like, it's no hold bars. Like, don't take it personal. And you know what's crazy though? We all understand our communication to the point where we don't take it personal, where we're just like, dude, that lady was about to die, son. And it's like, did you see that? And it's like, you just talk and laugh it out, and nobody takes it personally, unless it's probably your enemy or something. Like,
no, when there's an emergency, it's very like one word, right? Like, I've been able to move. Like, I've scooted people, like, move. Like, the patient's dying, excuse me. Like, get used to it, and then you'll realize after the emergency, things go back to normal. Because at first I swear to God, I thought a lot of the nurses hated each other. And then right after being so mean to each other, I'm seeing them go to lunch. And I'm like, y'all so fake. But now I realize, like, we don't have to say, please, me, you, can I? Like,
right. That's another advice. When you are on your own, that's the perfect time for you to learn. That is the best time. I learned a lot.
Like, not learning new things, but more so what flow works for me. So Samantha's a great nurse. I'm a great nurse. However, we work differently. There may be some similarities, but I like things a certain way. She likes things a certain way. That's our own flow, right?
Right.
When you're orienting, it's not that your preceptor wants you to do everything they do, but naturally, that's how they're going to critique you, right? Like, you didn't do this before this. Oh, my last tip. We touched on it many times before about keep learning, be open-minded. So I think a lot of mistakes that new grads make is they limit their learning to only when they're at work. And you shouldn't do that. So on your off days, I'm not saying spend 12 hours a day reading, but most facilities, job locations, they have an online resource, especially if it's in hospital, and you can access that at home. There are several databases, articles, magazines, books, videos that you can look through. So say the day before, if you had a situation, say, I don't know, maybe a patient needed to have an IND of something. Maybe you can look that up, what it entails, what's anticipated, what do you do as a nurse, so that the next time you have it, you're more comfortable. Oh, and another thing to piggyback off of that, try, even though every patient is not the same, try to lump them up so you know what to do. So for example, if I have a patient who is hypotensive, I already know what to set up for my room. I need lines, I need fluids. If my patient is coming in for respiratory distress, or they're like COPD, CHF, I'm expecting Lasix, I'm expecting this and that, like start lumping them up so that it goes a bit faster. I'm done now. I'm done for real this time.
Congratulations. But honestly though, like, you'd be surprised how many people who are actually willing to teach you the right way and the right thing. So just be ready to be a sponge. Just soak it all up.
That's my sponge sound. With that said, farewell.
Bye, y'all.
Bye.
Bye.